Hello, or hola, my name is Natalie Rivera. I'm an occupational therapist enrolled at Shenandoah University, taking the occupational science course. This project is focused on discussing global health initiatives across the world, with my topic being the prevalence of smoking in Spain. The reason I decided to pick this topic and this country was because when I went to Spain in 2018, as well as in 2007, I was blown away with the prevalence of individuals smoking inside a building. When I was on my Uber back to the airport in Madrid, Spain, it caught me off guard that one of the taxi drivers, Uber drivers, also told me that the highest rate of death, at least in 2018, was lung cancer. As I reflect on occupational science, behaviors, and habits, I attributed the lung cancer to possibly the correlation of smoking habits in Spain. I hope you enjoy this presentation, and we'll discuss a little bit more about the initiatives that have been discussed in Spain, have been implemented in Spain, as well as cultural factors and the repercussions of smoking on overall health. Some of the objectives of this presentation include the statistics and smoking prevalence in Spain, as well as respiratory health conditions in Spain, repercussions of smoking habits and health conditions, as well as a comparison in statistics with the United States, behavioral, social, and cultural expectations and norms in Spain, as well as established and possible actions taken to increase smoking cessation or reduce smoking habits. So these are some of the statistics that came about with smoking habits in Spain, as well as with the general population. These are some of the highest numbers that stood out to me. However, in the bottom section of this PowerPoint, in the notes section, you can see further information on statistics as well, which I will verbally speak about here. In Spain, about 31.8% of the population smokes in 2021, with 22% of those being daily smokers. That means they are taking either a classic cigarette or an electronic tobacco vape approach, which with modern technology, there have been different ways to consume tobacco. In 2016, it was reported to have 53,436 deaths, which were attributed to tobacco use due to secondary conditions. 85% of those deaths occurred in men. 50% of those deaths included those of the lowest education level, which is 27% of the population. 25% is in the medium low education level, which is 28% of the general population. 15% of those deaths included medium high education, 25% of the general population, and 10% of those deaths included those at the highest education level. So the highest prevalence of deaths related to tobacco use included those with the lowest education level. I would also like to add that 21% of adolescents ages 15 to 16 smoked cigarettes in 2019. And this has become a pediatric epidemic in Spain, because many of new smokers are in that age group. One of the latest surveys from a European school survey found that 54% of young Europeans aged 15 to 16 years had smoked a cigarette at least once in their lifetime. And more than half of the lifetime smokers had smoked cigarettes in the previous 30 days. Vice versa, which we'll talk a little bit in the United States. It's shocking because in the United States, only 7% of high school students indicated some form of tobacco use in the previous month. This slide is a graphic model of comparison of smoking prevalence around the world from 1970 to 2020, as well as comparing male and females. In this PowerPoint presentation, we're really going to compare the United States and Spain, but for purposes of anyone that may be interested in other countries, this is just also a graph to compare it on a global level. So to break down the color scheme, a dark blue signifies less than 10% of individuals smoke. Light blue is 10 to 19%, yellow is 20 to 29%, orange is 30 to 39%, and red is over 40%. Spain, I'm going to change the color to blue, is right here for purposes of a comparison and visual. Therefore, like I said, we are comparing males and females. In the United States and in Spain in the 1970s, there was an higher significant prevalence of smoking habits, especially in males. When you look at the United States, there was a prevalence in males from 30 to 39% and 40% for males in Spain. So the prevalence of smoking was a little bit higher in males in the 1970s, but the prevalence was still very, very high. When you compare males and females, in the United States, it was also 30 to 39% among females, and in Spain, it was also 30 to 39%. So females were both in that same color bracket. When we skip forward couple of years, many years, 2020, we could see that the United States men have really went from an orange bracket of 30 to 39% to a light blue bracket of 10 to 19%. And then men also declined in Spain from a red bracket to a yellow bracket of 40% being red bracket to yellow being 20 to 29%. We are still seeing that males in general in Spain tend to smoke more than they do in the United States. Now, when we look over to the female aspect of things, females have stayed pretty equivalent to males as well in the United States, like I said, with a light blue of 10 to 19%. And then females in Spain went from orange to yellow to, so therefore 20 to 29%. That being said, comparing the 2020 data, in the United States, males and females both are in the light blue bracket of 10 to 19%, and they've declined. In Spain, they've declined as well, but they are still in the yellow zone of 20 to 29%, meaning that there is a higher smoking prevalence in Spain than there is in the United States overall. Consequently, there's many complications that are secondary to smoking, some of them being cardiovascular disease, such as increased heart attacks, and overall decreased heart health. Increase in lung and pulmonary illnesses such as COPD and lung cancer, as well as brain effects. It was noted that with smoking, there's a thinner cerebral cortex than those that are non-smokers. In other words, smoking was destroying the gray matter in smokers. It's important because the cerebral cortex is that part of the brain that is critical for thinking skills, executive functioning, memory, and learning, which we'll discuss a little bit as well, that in Spain, one of the leading causes of death is Alzheimer's. So maybe it could be a correlation between smoking habits and possibly the development of Alzheimer's dementia type, which I believe there should be further studies done on that. That's just my critical thinking skills right now. Additionally, smoking also affects overall bone health. Something I always tell a lot of my patients at work is that when they come in with a fracture, they say, how long will it take for me to get better? And I always say, really, it depends. It depends on how healthy you are, how young you are, do you smoke? Because overall, nicotine slows the production of bone-forming cells, which are critical for healing. So they seem to break down what really helps us heal and helps our bones heal and recover. Now, that being said, in this slide, we'll talk about the top 5 causes of death in Spain versus the United States. I really want to have a very clear disclaimer that the data when it comes to percentages was very different for the United States and then Spain, with some articles in Spain saying the population that died from certain conditions versus the United States doing percentages. So the data for Spain is from 2018 and the data for the United States is from 2020. So I just really want to clarify that. However, from the United States perspective, they did say that the changes, the leading causes of death from 2018 to 2020 wasn't very different with the exception of the COVID-19 pandemic. So that being said, the top 5 leading cause of death in Spain include lung cancer, specifically lung cancer, COPD, stroke, Alzheimer or dementia type diseases, and heart disease. Versus in the United States, it is at number 5, stroke, at number 4, accidents, at number 3, COVID-19, at number 2, any form of cancer, including pancreatic, colon, any form of cancer, and then number 1 is heart disease. So both nations' leading cause of death is heart disease. However, if you look at Spain's top 5 causes of death, there's a lot more emphasis on respiratory conditions and pulmonary conditions than there is in the United States. Therefore, why is smoking so prevalent in Spain and in Europe as well? This was very fascinating to research on. There was an individual that posted a theory that because Christopher Columbus found tobacco in the New World in America and he sailed for Spain and brought it back to Spain, many individuals, this individual was saying that that could possibly be the reason that they brought so many use of tobacco back to Spain and it just ingrained in their culture. That was very interesting to read about. However, that's not scientifically based. That was just interesting, an interesting read. Another interesting fact is when I was in my Uber drive that my Uber driver in Spain was telling me that individuals smoke cigarettes like consuming alcohol, that they are literally sharing cigarettes, which maybe this has declined with the COVID-19 pandemic as well. But back in 2018, he would tell me that individuals would smoke and then be like, hey, here's my cigarette, you take it a little bit. And it was kind of a social expectation. However, I couldn't find any research on those kinds of statements. Those are just comments that I read and comments that I heard, but I also thought was very interesting to this study. From a statistical standpoint, out of the 20 countries that smoke the most cigarettes in the entire world, 50 of them are entirely or partially in Europe. The United States is actually 68th on the list. So prevalency of smoking in Europe is very, very high. Spain is not the number 1 country. Greece and Belarus are. However, possible reasons why in Spain in particular there could be an increase of smoking habits could be related to socioeconomic status. As discussed previously in the causes of deaths with the 54,000 individuals that passed away and 50% of the population being of the lower income status, those that have a lower income status tend to be the ones that are smoking more. Consequently, in comparison to the United States and according to the National Bureau of Economic Research, in general, the United States tends to have a higher income than those in European countries, which may be a factor as to why individuals are smoking more in Europe than in the United States. Additionally, Europe has even higher taxes on cigarettes than the US government, so culturally some individuals may be like, we're already getting taxed on this anyway, so it really doesn't make a difference to them from their standpoint. They're just used to paying higher taxes. To them, it's not as much as a barrier versus in the United States, we're probably not paying as many taxes. So when they increase taxes on tobacco products, individuals were probably like, this is not in my budget, possibly. There could also be lack of awareness and education with, in the United States, there are significant campaigns in early education, such as the DARE program, which are found in elementary, middle, and high schools. And they talk about the principles of tobacco and the chemicals of smoking, um, which is something I remember as a kid being so surprised going to Spain in 2007 and seeing so many individuals smoking indoors. I thought that was so alarming for me because that was not something I noticed here in the United States. Furthermore, a college researcher published a qualitative study, and she found a response that individuals under 25 years old, young adults, um, she would educate them and tell them that there were 4,000 chemicals in cigarette, which is the equivalent of rat poison and nail polish remover. And their response was that they screamed, they were shocked, they were not aware that there were so many chemicals in tobacco products. And to that researcher, she was surprised because she said for some of these individuals, this is the first time they even heard about this. There's relatively very few studies on smoking cessation in Europe, especially in the younger ages, but there is a study that came out that noted that around 25% of schools are not educating on tobacco and smoking as part of their curriculum. Lastly, another area that could also be prevalent in smoking habits includes stress and emotional management, and just overall social norms to manage stress. With stay-at-home orders with COVID, many individuals' anxiety and stress levels have gone up. Many governments across the world deemed tobacco products as essential commodities during lockdowns, which further boosted the sales. Around 22% of the Spanish population actually suffers from a mental health condition during 2020, and almost half of the population realized that with this change with COVID-19, there would be an increase in stress and anxiety. 14% experienced anxiety, and 10% experienced depression. However, in Spain, there has been an increase of anti-anxiety medications. However, there is still the cultural stigma surrounding mental illness, which is a significant issue in Spain, as it is still viewed as quote unquote taboo rather than an actual mental health and health condition. Developmental goals are goals that include 17 goals and 169 targets to be achieved by 2030. The overall long-term goal is to reduce premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being, as well as to end poverty, protect the planet, and ensure prosperity for all as a new sustainable developmental agenda. In regards to the goals, in comparison to tobacco use, for good health and well-being, number 3, it's the overall goal of having good health and preventing substance abuse, including narcotic drug abuse and harmful use of alcohol, having increase in health financing and recruitment, training, and retention of health workers as well, to educate on the prevalence of alcohol use, tobacco use, any form of substance, as well as reducing the use of overall substances. When it comes to economic burdens, it's also, as we discussed before, the prevalence of those of lower economic status having that increase correlation to use substances. So there is also trying to have more equality among different socioeconomic groups as well, and perhaps education and resources among different socioeconomic groups to prevent the habits of smoking or excessive alcohol consumption. Number 12, responsible consumption and production of tobacco, which in Spain, tobacco is grown in 12 European Union countries, and Spain is actually the third highest producer of tobacco in the European Union. And then lastly, partnership with the government, with researchers, with schools, and overall partnering up with one another to educate and prevent the use of tobacco use on a not just Spanish level, but global level. Now, there's a model that I discovered online when looking up primary and secondary interventions. This is not my main model, but this was just an interesting model to look at. With health promotion, we have the general population at the bottom. Like we have a pyramid. In a pyramid, our basis is our foundation to get to the top. That being said, health promotion is our basis. So having public health campaigns, having public health policies and education on a societal level. Second, we move to primary prevention and asking individuals about tobacco use and advice to stop, timely diagnosis of smoking, brief advice, and then referring to higher levels of addiction and getting that automatically available as a resource to individuals in the public. Secondary prevention would be asking about tobacco use and advice on tobacco users and telling them to stop. Brief advice on stopping to smoke. Pharmacological interventions such as patches or behavioral interventions as well. And then lastly, intervention, the highest level would be smoking cessation, psychological treatment, motivational interview. So this is a very interesting diagram that I found that I believe is applicable to this presentation. However, in the next slide, we'll talk a little bit of Mercurich model of health. I can never pronounce that one, but this one is essentially the model when it comes to smoking. We're looking at the individual, so we look at the age. We kind of discuss about how younger individuals, 15 to 16, are smoking a lot. The race, which is the cultural race that we're dealing with in Spain. Socioeconomic status, how we discuss how those of lower socioeconomic status are at higher risk to wanting to smoke. Gender, as we discuss on a global level, that males in general tend to want to smoke more than females. However, in Spain, it's pretty equal. We move over to interpersonal, such as family, friends, physicians, which those are our educators and some of the biggest individuals that do educate us to cease smoking habits. Community and organizational levels, such as schools, the healthcare system, workplaces, the media as well. So for example, we discussed that 25% of schools do not educate on smoking. So that's one area. Or media having frequent advertisements of cigarettes and tobacco products, which in the United States we don't have as much anymore. And then from a societal perspective, policies, taxes, which we discussed that in Spain, yes, they do get taxed for tobacco, but for them it's not as shocking as it was in the United States, as well as policies that the government also establishes as well, which we'll discuss in the next slide. There have been various protocols as well as interventions that the Spanish government, as well as from a societal aspect in Spain, have implemented. When I went to Spain in 2007, I really want to emphasize that I've seen this with my own eyes. In 2007, as a little girl, I always remember seeing individuals smoke in my hotel lobby or in the cab or in the taxi or inside restaurants, and that is something that was such a red alarm for me because my first thought as a little girl was, "Oh my gosh, they're going to burn this building down." Now, as a health professional, I look back and I'm like, wow, I cannot believe that individuals as of 2007 that I was alive and I went and I saw it were smoking indoors, and I've never seen an individual smoke indoors in the United States. When I went in college in 2018, however, I also noticed, wait a minute, there's not that many people smoking indoors anymore. What happened? Like, I remember as a child, this was so prevalent. As a matter of fact, in 2010, there was a ban on indoor smoking by the Spanish government, which was very controversial at the time, but really took an effect as I witnessed with my own eyes. I don't see individuals smoking indoors anymore. In addition to that, the Spanish government in 2022, also established a ban on smoking on public beaches, which is also sustainable not only for our health, but for our environment as well. Mainly their motive was not only for health, is that many of these cigarette butts had been they were non-biodegradable, and it was causing many environmental issues on the beaches over in Spain. There has also slowly over the years, which has not been as shocking as in the United States, increased taxation on tobacco products, as well as regulations on tobacco producers. Additionally, there has been regulation of tobacco advertisements in Spain over the years, as well as a method from a societal perspective to reduce smoking habits. Lastly, there has been an increase of behavioral intervention. In Spain, there are 4 main sources of behavioral interventions that were implemented on a national level, including specialist support, either one-to-one or group-based, those are 2, telephone support, or text messaging. There have also had a significant increase in pharmacological options such as nicotine replacement therapy, and gums or patches, and medications for some. Though there has been smoking restrictions placed in Spain, and there has been a significant decline in smoking habits over the years, there's still room for further education and further suggestions to help reduce this habit. One of them being routine mental health screening, whether that is through a phone, whether that is through your mental health provider, and further education to the public on mental health conditions, as well as mental health resources to seize and incorporate healthy habits to reduce anxiety, depression, or overall management, overall health in a much healthier way rather than substances. Continued restrictions on tobacco companies, which the government is slowly working on in Spain, but that would be a greater option to do as well. As we discussed earlier, further education in the school system, as 25% of schools do not have education on tobacco products, so possibly incorporating programs like the DARE program in the United States, as well as incorporating healthy habits and mindfulness and anxiety reducing habits at a younger age. As we discussed, that the age group of 15 to 16 is very prevalent in smoking, so really targeting that age group to start making that small but greater sociological impact on the long run. I hope this presentation was informative. My contact information is nrivera21@su.edu. The references will be on the next slide, which I'll further go in a little bit more details. And if anyone has questions, they could email me at my email. Thank you so much for your time. There were many resources and evidence-based articles for this topic of Spain and smoking prevalence, as well as smoking prevalence in the United States and on a global level. Therefore, the resources and references are attached to the link below on a Google Doc, where you can further find all the references needed per slide. Additionally, on each slide under the notes section, there should be the references for each of the information that was put on the appropriate slide. Thank you again.